The diagnosis of ADHD is a clinical diagnosis based on observable behaviors. This is how diagnoses are made in psychiatry, by observing people, taking a history. But people are much more complex than just observing them. Sometimes behaviors can express different disorders. This is especially true with children, who have such limited ability to express themselves verbally. Children usually don't go around saying, "I'm depressed." They act it out. Thus, the mental health professional must be sure that other conditions are not causing these behaviors. First, an MD must rule out medical conditions. Then a psychiatrist or psychologist must rule out psychiatric conditions that can mimic ADHD. It is also important to realize that ADHD can occur as a coexisting disorder with another disorder. So the first step, we must look at whether or not the ADHD is caused by some medical illness. Those medical illnesses could be sleep apnea, substance abuse disorder, developmental disorders, use of other medications such as cocaine, albuterol, which can cause hyperactivity and impulsivity as well as inattention, a seizure disorder, or vision or hearing problems. The differential diagnosis in psychiatry of ADHD from other psychiatric disorders must be distinguished from a mood disorder, such as bipolar disorder, depression, agitated form, or a tired, lethargic depression that can look like inattentive ADHD, psychotic disorders, such as schizophrenia or temporary psychosis secondary to drugs, organic brain syndrome, adjustment disorders, which are children reacting to their surroundings and the multiple stresses that may be occurring. Anxiety disorders are disorders that can mimic ADHD because of the fact that anxiety increases a child's activity level and can also distract them, such as when they become rather obsessive or compulsive, when they're distracted by their high levels of anxiety. So the distinguishing between anxiety and ADHD is an important step in the diagnosis. Learning and language deficits are very important to distinguish because they can also look like ADHD. This is particularly complicated since 50% of children with ADHD have learning and language deficits. One of the characteristics of learning disorders, particularly auditory processing disorders, is distractibility. Children don't seem to listen when they're being talked to. They can't follow directions. But again, the etiology of this is not on ADHD, but rather an auditory processing disorder. And lastly, children and adolescents who are under immense types of stress can also show characteristics of hyperactivity, impulsivity, and distractibility.